So welcome to this webinar on health anxiety and medically unexplained symptoms. I'm Dr. Amit Sharma. I'm a GP partner here at Berkshire Group Practice with a special interest in mental health and in particular around health anxiety. I'm delighted to welcome Claire Hall, who is a senior clinician from NHS Berkshire Talking Therapies, and Dr. Abrar Hussain, who's a consultant psychiatrist in medically unexplained symptoms coming from the NHS Berkshire Foundation Trust and Circle Reading Hospital. I'm going to hand over to Claire to talk to us about health anxiety.
Thank you. Okay, hi, my name's Claire. I'm from Talking Therapies in Berkshire. We treat common mental health problems, including anxiety and depression. One of the disorders we treat is health anxiety, and that's what I'm going to be talking to you about today. So it's considered to be, it's a severe and a persistent anxiety that's focused purely on the health. Usually the concerns are that a person either has already a serious illness or will go on to develop it. And it's fairly common as well, both amongst men and women. And it results from and is maintained by misinterpretations of normal bodily sensations or symptoms that someone might notice, and they might perceive them to be more serious than they are. So, for example, someone might have a headache and believe that that's a sign of a brain tumour, or they might notice a blemish on their skin and assume that it's skin cancer. And those misinterpretations, they can either come up as negative thoughts, vivid negative images about the consequences of living with a serious illness or the treatment that might be associated with it. Next slide, please. So the symptoms of health anxiety, so often people are very preoccupied with having or getting a serious illness at some point in their life. There might not be symptoms present, but if they are, they tend to be very low in intensity. So there might be another medical condition present, or there might be a high risk for developing a medical condition, like a family history. But the preoccupation is very excessive or disproportionate. So there might be somewhere in the family a history of say, a cancer, but it might be, quite a distant relative, and people might then be completely preoccupied and excessively worried that they're going to get that same serious illness. Often there's a high level of anxiety about their health, and people can become easily alarmed about, any kind of symptom that they might go on to develop from, a small symptom. So, maybe a headache, that might be kind of really disproportionately perceived to be something more serious than it is. And people often perform excessive health-related behaviours, like repeatedly checking for signs or symptoms, monitoring their body. They might then avoid doctor's appointments or hospitals, or they might then do the opposite, is excessively go to the GP to ask about having tests or having investigations for things. The next slide, please. So there's no one cause for health anxiety. There might be many contributing factors. So a person may have experienced an illness early on in their life, their own illness or illness within the family of a loved one. There might have been the death of a loved one, and there also might be some family beliefs around health, around sort of monitoring your health and needing to be sure about what symptoms mean. So it might be a kind of a learned behaviour from families. There might be also personal rules or beliefs that bodily sensations or symptoms always have to indicate something. There might be beliefs that the doctors will miss something, or they need to be more vigilant because the doctors will miss something. And also there might be excessive worry about how their lives might be negatively impacted by serious illness. And there might have also been previous illness to them or to someone that they're close to, or there might have been sort of a medical mishap along the way. And one of the main causes is the misinterpretation of normal bodily sensations. So the body naturally you have headaches, you have different bowel movements, noises, bumps, pains, and the difference with people who have health anxiety is that often they misinterpret those symptoms to be something more serious than they are. Next slide, please. So some common behaviours with people who have health anxiety is that they will try and seek reassurance from friends or family that they don't have a serious illness, or they won't go on to develop one. And what happens with that is that they temporarily become maybe a little bit more at ease and a little bit more reassured, but then that will soon return, so they need to go back and get more reassurance, or they might do the same with the GP. As the third one down is frequent visits to the GP, requests for investigations, tests, referrals to specialists. They might also have specific attention to certain parts of their bodies. They might be scanning or checking for bumps or monitoring their pulse, which can then be misinterpreted for something. You know, if your pulse is a little bit quicker, it could be misinterpreted for, I'm going to have a heart attack because my pulse is so fast. People often Google symptoms, they read medical information, they self-diagnose, but again, that's unhelpful behaviour because that sort of feeds in, which I'll talk to you about in a minute. They might take vitamins or medicine to prevent illness, and that they might excessively rest or avoid exercise or physical exertion because of their heart beating faster might be of concern to them. They might avoid talking about illness or reading about it, hearing about it. And they might ruminate, they might excessively worry about illnesses and the consequences, and then they might do things like avoid certain foods. Next slide, please. So how health anxiety is treated is through CBT, so it's cognitive behavioural therapy, which helps clients to recognise some of the unhelpful behaviours and thoughts that they're engaging with that might be maintaining the health anxiety. So seeking reassurance, as I've already mentioned, so ruminating, checking for bodily sensations, more attention paid to health information, maybe reading more up about a certain condition or health concern, and self-diagnosing, which is kind of self-fulfilling, because if we look for enough symptoms, we'll find that we fit them, even though we may not fit the whole diagnosis. Next slide, please. So just a really brief case study. Someone open to talking therapies in the past was a female. She was in her mid-20s. There was illnesses during her childhood due to allergies that weren't identified, and then she went on to have an allergic reaction to medication that was administered in hospital. One of her grandparents also fell over and died due to a heart attack suddenly. And one of her parents also had health anxiety and worried about her children's health, so the client's health. So she went on to develop beliefs around, I'm always going to be sick, people fall over and die all the time, I'm more vulnerable than others, I need to be really careful or I'll get sick, I need to be more vigilant and monitor symptoms. And I have to be the one to be vigilant for serious illness because no one will pick it up. So you can see how hers has developed due to early experiences in her childhood and with her health. Next slide, please. So this is how we try to understand how thoughts, feelings, behaviours and physical sensations are all linked. So it might stem from the thought is that I was right, the doctors don't know what they're doing, I need to be more vigilant. That might increase someone's anxiety. They might have physical sensations associated with that anxiety, like dizziness, sweating, stomach churning, and that perception of, if I've had these physical sensations, they might mean something serious. And so then they might start monitoring their physical sensations and get more tests, which increases the anxiety, which is maintaining the problem. Next slide, please. So the effectiveness of CBT. So the guidelines generally recommend 8 to 16 sessions of CBT on a weekly basis, and there is very good evidence to show that CBT works. And that can be accessed through Talking Therapies. You can go onto our website and self-refer, or you can call the office. And we deliver face-to-face sessions and via video in various locations across Berkshire. Next slide, please. So CBT, the sort of main treatment components are that we look at your symptoms and we sort of challenge beliefs that might be related to those symptoms. We might also look at what else the symptoms might mean. So if someone has a headache, does it necessarily mean a brain tumour? How else could that be explained rather than going to the worst case possible? And we reduce some of those unhelpful behaviours that we spoke about earlier, like reassurance seeking and Googling symptoms. And we do behavioural experiments to test beliefs and behaviours. So we might ask you to engage in certain things just to test whether actually it's a helpful behaviour or it's unhelpful. And we look at the likelihood of somebody getting a serious illness, because typically when someone is anxious, they overestimate the risk. So we help people to look at maybe from a more rational perspective. And then we also look at thinking errors like catastrophizing. So cancer can't be cured, it's going to completely ruin my life. We look at actually how true is that. Next slide, please. Okay, I'll hand over to Dr. Hussain.
Thank you, Claire. And thank you, Amit, for the introduction. My name is Abrar Hussain. I'm a psychiatrist, and I'm going to talk to you about medically unexplained symptoms and FND, functional neurological symptoms. So MUS are physical symptoms, which are real experiences, and they can be quite distressing. So what happens in MUS is when you do a brain scan or some other test, the structure of the body and the nerve system is actually preserved, and there's no structural damage that can be seen. But what's going on is some issue or some problem with the way the body is functioning and the way the nerves are functioning. So that abnormal functioning gives rise to physical symptoms which are not very well explained by a known physical disease, and that's why they're called unexplained symptoms. They're quite common. So in primary care, patients with CGPs, 1 in 4 will have some medically unexplained symptom going on. And the tricky thing is that routine tests and investigations cannot explain this using the traditional medical model. Next slide, please. Closely linked to MUS is a condition called FND. And within FND, we see people reporting neurological symptoms. For example, weakness, tremors, numbness, blackouts, and also sometimes I've seen patients with speech and swallowing difficulties and visual problems. And once again, when the tests are done, when there's physical examination or a brain scan and blood tests, there isn't any organic, as in a physical change that we can appreciate within the brain or the nervous system. And once again, the problem here is the nervous system does not seem to be functioning as it should be. And that is giving rise to these symptoms. One way of understanding FND is by thinking of a computer model. So the hardware is actually preserved. There's no damage in the hardware, but the way the programs work, the software in the computer is not working well. There are glitches and the computer is rebooting a lot and not really functioning well. And that's what gives rise to the physical symptoms in the human body. Next slide, please. So in order to make a diagnosis, usually a physician, can be a GP or a neurologist, will take a history, which means they'll ask you lots of questions about the symptoms and then understand what's going on. And they might also do a physical examination to test certain nerves or parts of your body. And the aim would be to try and make sure that there is no physical structural damage that might explain these symptoms. Now, sometimes FND is quite obvious from the outset. So we don't have to necessarily rule out all the possible organic causes. And if there are positive features of FND, that can be diagnosed as a condition so that treatment can start early. What we see in practice is that vast majority of diagnosed for FND, there is a high level of accuracy, and only less than 5% may not be accurate. But that's very comparable to any other physical condition like Parkinson's or motor neuron disease. Now, we also have to remember that an FND can coexist with a condition that causes structural problems in the brain. For example, in a minority of patients, there can be epileptic seizures, but also what we call non-epileptic or functional seizures, and they can coexist. So it is possible as well. In general, repeat testing is not helpful. Once FND is established, it is helpful to draw a line under further investigations, because the more tests you have, the more risk of exposure to radiation or having side effects from, for example, a lot of blood tests. So it's good practice to actually stop tests at some point. Next slide, please. So what's helpful to take the journey forward is to understand what's going on for us. So what's happening actually within the body in MUS and FND, and being curious is the first step. So being curious about these symptoms, what do they actually mean for each person? And there's no one size fits all approach. For each person, the symptoms may actually communicate different meaning and different information. So being curious is the first step. Understanding when the symptom first started, what was going on, for makes these symptoms worse, proves then that that's helpful. And sometimes the combination of health anxiety and these unexplained symptoms be more difficult to manage and make them more intense. Next. So our brain is a fascinating organ. It's working all the time to try and keep the body in the right. The word we use called homeostasis, which means that everything needs to be functioning at an optimal level. Now, the brain does that by picking up information from the organs and the limbs, the peripheries. Generally, we send messages to and from the brain using electrical signals called shells. And additionally, the body has a very complex system of chemical signals using hormones and neurotransmitters. Now, when all of this, the body is, there's no software problem, no symptoms. But sometimes these messages can get scrambled, and the brain starts to interpret the scrambled messages and then starts to generate symptoms. And it's seen that whenever the nervous system loses a degree of certainty or connection or control, things that are brought on by stress and other difficulties, then the nervous system goes into some kind of a chaos or rigidity. And understanding that is helpful. Next slide, please. So the brain likes to organize things and file things. When we have a particular experience, we learn from it, and the brain puts that neatly into a filing cabinet. It has different sections, it has different rows, if you like. But what happens during something which has been quite difficult to manage, like a trauma or difficult experience, is that that filing cabinet is not well organized. So our experiences, which should tell us more about ourselves, they are not actually helping us in that particular time. A part of the brain called the amygdala is responsible to keep us safe. So the amygdala is like a smoke detector, which looks out for danger, which looks out for threat. And whenever there is threat or trauma or distress, the amygdala starts to function a lot more than it should, and it starts to pick up even normal things as traumatic experiences. And that threat can then cause the nervous system to go into disruption, scramble the messages, and we can go into a fight or flight response, or sometimes we can actually freeze and become immobilized. So all of those things have an impact on the nervous system and then give rise to the symptoms. Next slide, please. Now, it is possible to recover from FND. And like I said earlier, it's about understanding what FND means for each person. Now, I've seen people who have done really well with recovery and gone on to not have any FND at all in the future. But sometimes the journey is not straightforward. It can be bumpy, and I think being curious and having kindness for yourself, having self-compassion, self-care, that's a very, very important first step in trying to manage these symptoms. Like I said earlier, there's no one size fits all approach, and anything that you can do to calm the nervous system down, that can be helpful. Now, in most cases, therapy like CBT is helpful to make those links between the physical symptom, the feelings, the thoughts, perceptions, and then to try and have a plan to help manage the symptoms. Sometimes therapy for trauma particularly can also help, and there is also a role for medication. Next slide, please. There are some couple of good resources. There's one good website called neurosymptoms.org and another one by the charity FND Hope UK, and also some books and resources. Thank you. I think we'll have some questions now, Amit.
Yes, great. Thanks very much for that, Claire and Abrar. Yes, we'll have some questions, and these are questions really that I get asked quite often in my GP surgeries. I see lots of patients with challenges with health anxiety and medically unexplained symptoms. And one particular thing that we hear a lot of is just people who feel that something physically must be wrong. So what would you say to someone in that situation?
Well, in terms of health anxiety, often people have tests and investigations that show nothing. So when we look at it from a psychological perspective, what we're looking at is, the facts and the reality. And just because we have a sense of something doesn't mean it's true. So when we experience anxiety, that often clouds how we view things. It may, we're kind of thinking with the anxious fight or flight part of our brain. We're not thinking with that sort of rational aspect. And that would be one of the things that we look at within CBT is those thinking errors, believing that something must be wrong because you feel it's true. We put that to the test a little bit about, how we can't predict things like that. We can't necessarily know that just because we feel it's true. So that's how we'd look at it with CBT.
Great. In terms of MUS and FND, so these are real experiences. So they're not made up symptoms, they're real symptoms, real experiences. And I think what's helpful is to understand that physical symptoms are arising from the nervous system due to something going on. So sometimes it's very hard to make a physical diagnosis, but wherever possible, if we have the diagnosis of FND or health anxiety, that's a starting point. And there is something wrong, but there is something which is not part of the usual neurological system of naming disorders. There is something going on which needs treatment and looking after.
Great, that's really helpful. Thank you. Another common thing is just whilst having tests, whether support should be sought for health anxiety. So Claire, I wonder if I can ask you about that, really, whether we should be having support for health anxiety whilst tests and things are ongoing.
Yeah, often we do see people who are still going through tests and investigations, and I think it's good to do it in tandem because sometimes that might help. But what we would be looking through eventually is to move away from that and look at it from more of a psychological perspective rather than assuming that it's a physical related problem.
Right, thank you. Now, obviously, people want to improve and feel better. What can patients do to start feeling better, Abrar?
I think patients can start at their own individual level, and the first step would be to try and understand what's going on, to try and read about the condition, whether it's health anxiety or MUS or FND, and really empower themselves with information. And if they understand about their own condition and how they respond to stress and trauma, then it helps a lot. Once that is done, or in parallel, patient can then reach out for specialist services and support systems where they can have access to particular therapy or medication and then start their journey. And each person's journey and recovery will be very different.
Yeah, great. Well, as you're talking about recovery there, patients will be wondering, can they recover from this? Is this something that has treatment that's been proven to be effective?
Yes, we know that many people recover from FND, MUS, and even health anxiety. And sometimes that recovery is about actually keeping in place certain practices and ways of doing things, which are a lifelong journey. So recovery is not particularly an endpoint necessarily. It's an ongoing journey of understanding about ourselves and how we operate in this world. So there is recovery possible. In some situations, the symptoms might still persist despite treatment, despite empowering with information. And I think it's helpful then to think about the condition as a more long-term condition and start to adapt to the changes and start to do things which are actually helpful and help us to reach a good state of health as much as possible.
Okay, thanks. And then to both of you, you've mentioned some resources that would be helpful. Are there any others or particular ones that you'd recommend for patients to use?
For health anxiety, we use a website called CCI, which is the Centre for Clinical Interventions. If people Google CCI health anxiety, it's a Western Australia website, but it has various modules on health anxiety that people can work through, sort of self-help. There are different modules around understanding health anxiety, what's keeping it going, kind of a lot of the CBT-based interventions that I've talked about today. And there's also some leaflets on there. So I think that's a really good starting point.
Great. And for physical symptoms, there's two good websites, FND Hope UK, the charity, and neurosymptoms.org. And also a couple of lots of books, but a couple of ones that I would recommend highly. One is called Walking the Tiger by Peter Levine, and the other book is called When the Body Says No by Gabor Mate.
Brilliant. Oh, that's been really helpful from both of you, and I'm sure that'll be really valuable for our patients to understand more about health anxiety and medically unexplained symptoms. Thank you, Claire and Abra, for your time. Thanks very much.
Thank you.
Thank you.